Extensively drug-resistant tuberculosis is a form of tuberculosis caused by bacteria that are resistant to some of the most effective anti-TB drugs. XDR-TB strains have arisen after the mismanagement of individuals with multi-drug resistant TB. The true scale of XDR-TB is unknown as many countries lack the necessary equipment and capacity to accurately diagnose it. By June 2008, 49 countries had confirmed cases of XDR-TB. By the end of 2017, 127 WHO member states reported a total of almost 11,000 cases of XDR-TB, and 8.5% of cases of MDR-TB in 2017 were estimated to have been XDR-TB. Symptoms of XDR-TB are no different from ordinary or drug-susceptible TB. A cough with thick, cloudy mucus, sometimes with blood, for more than 2 weeks, with fever, chills, night sweats, fatigue, muscle weakness, weight loss, and sometimes shortness of breath and chest pain. TB is one of the most common infections in people living with HIV/AIDS. In places where XDR-TB is most common, people living with HIV are at greater risk of becoming infected with XDR-TB, compared with people without HIV, because of their weakened immunity. XDR-TB is caused by Mycobacterium tuberculosis strains that fulfill the definition of MDR, RRTB and which are also resistant to any fluoroquinolone and at least one additional group A drug. The group A drugs are currently levofloxacin or moxifloxacin, bedaquiline and linezolid. Therefore XDR-TB is MDR, RRTB that is resistant to a fluoroquinolone and at least one of either bedaquiline or linezolid. Like other forms of TB, XDR-TB is spread through the air. When a person with infectious TB coughs, sneezes, talks or spits, they propel TB germs, known as bacilli, into the air. The bacterium has the ability to stay in the air for several hours. If TB bacteria are found in the sputum, the diagnosis of TB can be made in a day or two. However, this finding will not be able to distinguish between drug-susceptible and drug-resistant TB. To evaluate drug susceptibility, the bacteria need to be cultivated and tested in a suitable laboratory. Final diagnosis in this way for TB, and especially for XDR-TB, may take from 6 to 16 weeks. Countries aim to prevent XDR-TB by ensuring that the work of their national TB control programs is carried out according to the international standards for TB care. The BCG vaccine prevents severe forms of TB in children, such as TB meningitis. It would be expected that BCG would have the same effect in preventing severe forms of TB in children, even if they were exposed to XDR-TB. The principles of treatment for MDR-TB and for XDR-TB are the same. Second-line drugs are more toxic than the standard anti-TB regimen and can cause a range of serious side effects including hepatitis, depression, hallucinations, and deafness.